Welcome back to Talk of the Town. We are talking about possibly a business and a practice that you don't know a whole lot about. I'm excited to share it with you because Primal Air in Sun Prairie is able to help with a lot of different things, and we're going to chat about one of those right now with the primary practitioner Shirley Gutkowski. Thanks for being here today.
Thanks for having us. It's great.
So I have stumbled upon your business and just really learned a lot from chatting with you. We're going to talk specifically about tongue tie. Now, this is something that can happen in infants and, of course, can be present in adults. So first of all, share with us what that is.
Well, there's a little tissue that goes from the bottom of your mouth, from the floor of your mouth, up to your tongue. And you're supposed to have that. It's supposed to be attached. But in some people, it's attached either too far forward or too short. So their tongue doesn't move around the way that it should.
Okay.
I had a patient yesterday whose tongue is tied where it's too short, right? That little flap of tissue is too short. And her tongue squeezes out between her teeth. And so she can't bite her back teeth together at all because her tongue has taken up all that space. And she has a lot of TMJ problems.
Oh, wow. Okay, so that can really cause some issues, and that's one example, obviously.
Right.
Is this common?
It's, right now they're saying it's in about 4% of people and babies and infants.
That's surprisingly common, actually. I haven't, not really familiar with it, but that's a lot of folks.
It's a good number, and it does kind of complicate things along the way. If we find it in an infant, you will notice that the infant has a lot of trouble nursing, that the mother is in a lot of pain during nursing, that the baby is colicky because they're getting too much air. There's just a whole bunch of nursing issues, and very often they will release that tongue tie at an infant stage.
Okay.
But if the baby goes really good on a bottle and is gaining weight and stuff like that, then they're all like, well, it's not such a big deal.
Okay, so then they might leave it, but then might have problems as an adult if they let it go that far. So we chatted a little before we started. Now, it's important to have it released. And why is that, or how important is that?
Well, it's really important. As you can imagine, this patient I was just referring to a few minutes ago, she has such jaw pain that she has to wear an appliance 24 hours a day. And she has trouble eating, she has trouble chewing, she can't yawn, her mouth only opens about half as wide as it should. It's all because the tongue is not behaving right, and all of those symptoms then for her are accumulating in her jaw joint. So she's having a lot of pain. Some kids never really learn how to speak correctly because their tongue doesn't act right. And it may be because of the tongue tie.
Now, what is actually involved in tongue tie release? So how do we do that? What does that do?
It's pretty simple actually right now. In an infant, it's the easiest. One of the practitioners would be either a dentist, a pediatric dentist, or even a pediatrician, or an ear, nose, and throat doctor will be involved, and they will use a laser and just release it.
Okay. So
simply release it.
Simply put, yes.
No, but I don't know people that have to take like pain medication after.
Okay. So how do you know? Well, you shared with us a little bit about how you know, but let's practice a little bit about how you know if you have this tongue tie.
Okay, so here's 2 simple pimple practices that you can do.
I love the rhyme. Yeah. Okay.
So if you open your mouth as wide as you can without causing pain on here, and lift the tip of your tongue right behind your upper front teeth, it's known as the spot. So this, like that. And if your mouth closes more than 50%, then the chances are really good that you have a tongue tie.
Wow, okay.
The second one would be to open as wide as you can and use your tongue to touch all the very last molars. So,
I look silly, but I can do it.
You can do it.
All right. Yay.
So you're doing good. Yeah. So those are two simple things that you can do.
Okay, well, that's really good to know. And obviously, you can help folks with all kinds of different issues that can affect things from the way that you're able to eat and breathe, which can affect your sleeping, your well-being, and just so many different things that we barely have time to cover it in one short segment. But it's fun always learning from you. This is Shirley Gutkowski with Primal Air over in Sun Prairie, and I would just a pleasure to chat with you. Thanks.
Thank you.
I want to thank all of our guests for joining us today, and I want to thank you for watching. Please join us next time on Talk of the Town.